this is the composite specimen of the tongue, larynx and laryngopharynx. This is the tongue. The tongue is the pharynx and larynx. This is the mandible. This is an old person, so none of the teeth are present in the mandible. All the teeth have been dissolved. Between the lips and cheek and the teeth, this is the vestibule of the mouth. The tongue is attached to the floor of the oral cavity by a frenulum. Floor of the oral cavity is formed by the mylohyoid muscle. The tongue has two parts, an anterior 2/3 or body which faces upwards, and a posterior 1/3 or base or pharyngeal part which faces backwards. The surface of the anterior 2/3 is not smooth. The surface of the posterior 1/3 is relatively smooth, but it has elevations produced by the lingual tonsils, lymphoid tissue. The elevations on the anterior 2/3 are called papillae. Anterior and posterior parts are separated by this sulcus called the sulcus terminalis. And the apex of the sulcus terminalis is the foramen cecum, which is the origin of the thyroglossal duct, of which the thyroid gland develops. Just in front of the sulcus terminalis are these papillae, which are called circumvallate papillae. They are arranged in a V shape and they are supplied by the same nerve which supplies the posterior 1/3, that is the glossopharyngeus. These small elevations, bumps, these are the fungiform papillae, and the velvety appearance on the surface which can be felt is produced by the filiform papillae. On the side of the tongue are these folds are the foliate papillae. Below the mandible on this side we can see the intermediate tendon of the digastric muscle. This is the vallicula, which is supplied by the internal laryngeal nerve. The vallicula is bounded in front by the posterior part or base of the tongue, behind by the oral surface of the epiglottis, in the midline by the median glossoepiglottic fold, and laterally by the lateral glossoepiglottic fold. Below the epiglottis is the cavity of the larynx, which becomes continuous with the trachea at the level of the lower border of the cricoid cartilage. Behind the trachea is the esophagus, which continues from the pharynx also at the level of the lower border of the cricoid cartilage. So the trachea and larynx lie in front of the esophagus and pharynx. To enter the cavity of the larynx, we first have to cut the posterior wall of the pharynx. So this is the cavity of the laryngopharynx, which extends from the tip of the epiglottis C3 level to the lower border of the cricoid cartilage. In the laryngopharynx, this is the pyriform recess. In the lateral wall of the pyriform recess, if we palpate, we can feel the tip of the greater horn of the hyoid bone, and below that the tip of the superior cornu, upper cornu of the lamina of the thyroid cartilage. The hyoid and thyroid are connected by the thyrohyoid membrane. When the anterior wall of the laryngopharynx is cut, we enter the cavity of the larynx. The posterior wall of the larynx is formed by this, which is the lamina of the cricoid cartilage. This is the lower border of the cricoid cartilage, which is the lower limit of the cavity of the larynx. The upper limit is the tip of the epiglottis. The inlet of the larynx is formed by the epiglottis in front, arytenoid cartilage is behind, and the aryepiglottic folds laterally. Within the cavity of the larynx are the vestibular folds above and the vocal folds below. The region between the inlet and vestibular folds is called the vestibule of the larynx. Between the vocal folds and the lower border of the cricoid cartilage is the infraglottic part of the larynx, and the space between the vocal and vestibular folds is the ventricle of the larynx. The gap between the two vocal folds is called the rima of the glottis. The laryngopharynx and larynx are covered by mucous membrane. This is the mucous membrane, and the larynx is also covered by mucous membrane. The muscles and nerves can be seen only if this mucous membrane is removed. On the external aspect of the larynx, this is the thyroid cartilage, this is the cricoid cartilage. On this side, the thyrohyoid muscle is present, which extends from the oblique line of the thyroid cartilage to the hyoid bone, body and greater cornu of the hyoid. On this side, the thyrohyoid muscle has been removed, but another muscle is attached from behind to the oblique line. This muscle is the inferior constrictor of the pharynx, inferior pharyngeal constrictor. The middle constrictor is attached to the hyoid bone, the superior constrictor to the mandible. The inferior constrictor has two parts. The part which is attached to the oblique line of the thyroid cartilage is called the thyropharyngeus part. The part which is attached to the cricoid cartilage is called the cricopharyngeus part of the inferior constrictor. The cricothyroid muscle, which extends from the cricoid cartilage to the thyroid cartilage, is not present here. It has been removed. This region is damaged. These are the features which you should identify in this question.